Hi everyone. In this video, I'm going to be showing you how to get vital signs from your baby in the NBU or if it's after a delivery. So to start, before you always touch patients, you want to do hand hygiene. So I have my hand sanitizer here and some gloves. So to start with the normal vital signs for babies, they're a bit different than adults. So for pulse rate or heart rate, the normal is 120 to 160 beats per minute. The SpO2 or oxygen saturation is generally 90 to 100%. The temperature is 36.5 to 37.5 degrees Celsius. And then the respiratory rate or the amount of breaths the baby is taking every minute is 30 to 60 breaths per minute. So those are the normal vital signs. As a student, you'll be taking vital signs at least every 3 hours for your babies. And if at any point your vital signs are out of range or abnormal, you need to contact the nurse on duty or the nurse in charge. So let's get started. And we'll start with the SpO2 and the pulse rate. So I have a monitor here. And you always want to make sure that your monitor has enough battery or is fully charged, because if you're not checking, these will die on you and you won't be getting the vital signs. So I have my monitor here and I'll turn it on, place it here. For now, I'm just going to put it on the foot here. So you'll apply it here, make sure that it's not too tight and that it's not cutting off the baby's circulation to their foot. And then you'll give it some time to read. Whenever you're using the monitor, you always want to double check that it's accurate, because the monitors are not always right. So for example, if the monitor is saying the SpO2 is 95%, but the baby has blue lips, has cyanosis, then you need to notify the nurse on duty. So the monitors are not always right, and you should always double check them. So I've gotten the pulse rate and the SpO2 from the monitor. For the pulse rate, if it seems abnormal, you can always check manually. The pulse is here or here. Or if you have a stethoscope, you can listen for 1 minute and get the heart rate that way. But always double check with the monitors, because they're not always right. So the third vital sign I'm going to get is temperature. Again, the normal is 36.5 to 37.5. So you'll turn it on. And then we check under the armpit here. The most accurate spot to get a temperature is a rectal temperature, but that's not really done here. So you'll put it under the armpit until it beeps and reads. You'll look at it, see if it's in normal range. If not, you know what to do and contact the nurse on duty. So that's temperature. And then the last one is respiratory rate. So this is how many breaths the baby is taking every minute. You need to count for 1 full minute. You can use a watch, your phone, the clock on the wall, but you want to count for 1 minute, because babies' respiratory rates can vary a lot. They'll breathe really fast and then they'll slow down a bit, go to sleep. So it's important to count for 1 full minute. So you'll look at their chest, look at their breathing, and you'll count for 1 minute. And again, normal is 30 to 60. So if it's out of that range, you'll contact the nurse on duty. So those are the main things that you need to know as a student for taking vital signs. Again, always double check the monitor, because they're not always right. And if your temperature, respiratory rate, pulse rate, or SpO2 are out of range or abnormal, always contact the nurse on duty. Never be afraid to contact them and ask for help. So I'll see y'all in the next video.